Hello, my name is Maeve Bailey-Whyte and I'm a Cancer Prevention Fellow at the National Cancer Institute in the US. The title of the study I am presenting today is High Urinary Thromboxane B2 Associates with Lethal Prostate Cancer in African American Men and Inversely Correlates with Aspirin Use. I will begin with some background. Systemic low-grade inflammation is a candidate risk factor for prostate cancer in African American men, potentially contributing to lethal prostate cancer development. We previously reported that regular aspirin use is associated with a decreased risk of advanced stage disease and disease recurrence in African American patients with prostate cancer. The cancer preventative benefits of aspirin have been attributed to inhibition of the cyclooxygenase or COX pathway. Thromboxane A2 is an icosanoid produced by the COX-1 enzyme in platelets. Aspirin can inhibit metastasis by inhibiting COX-1 activity and thromboxane A2 synthesis. The purpose of this study was to assess the role of thromboxane A2 in the development of lethal prostate cancer and the potential benefit of aspirin for prevention of lethal prostate cancer in African American men through inhibition of thromboxane A2 synthesis. Because thromboxane A2 is unstable, we measured its corresponding primary metabolite, urinary thromboxane B2, to examine the relationship of thromboxane A2 levels with prostate cancer. Thromboxane B2 was measured in almost 2,000 European American and African American cases and controls from the NCI Maryland Prostate Cancer Case Control Study. Aspirin use and race ethnicity were self-reported in a questionnaire. Now to our results. We firstly report in this figure that urinary thromboxane B2 is elevated in African American men with prostate cancer when compared to the population-based controls. This prompted us to ask the question, was this higher thromboxane B2 important for lethal disease? In Table 1, we report that aspirin use inhibits the formation of thromboxane B2 in both cases and controls. Notably, however, the aspirin inhibitory effect tended to be more robust among both African American cases and controls compared to the European American men. Our aspirin data was self-reported, so this result gave us confidence in the data as aspirin is known to reduce thromboxane A2 levels. In Table 2, we show that having high, which is above median levels of thromboxane B2, was associated with prostate cancer in African American men only, with an adjusted odds ratio of 1.50, marked in bold font, but not European American men, suggesting upregulated thromboxane A2 synthesis in African American men with prostate cancer. Also, we report in unadjusted analysis in this figure that the highest median level of thromboxane B2 associated with prostate cancer patients who had developed regional and distant metastatic disease. This association remains statistically significant using an adjusted logistic regression model reported in Table 3. Thromboxane A2 has already been linked to metastasis in animal models, but this is the first time it is being shown in human prostate cancer. Lastly, although not shown here due to time, a higher proportion of African American men in our study died due to prostate cancer, confirming that African American patients are at an increased risk of lethal disease. We examined the role of thromboxane A2, thromboxane B2 in this survival disparity and show in Table 4 that high thromboxane B2 was associated with all-cause mortality with an adjusted hazard ratio of 1.59 in African American men only. In Table 5, we report that high thromboxane B2 also predicts prostate cancer-specific mortality with an adjusted hazard ratio of 4.74, but again, only in African American men. I will conclude with the key findings. We report a distinct association of high thromboxane B2 with aggressive prostate cancer, as well as adverse survival outcomes for African American men. As aspirin use is protective against high levels of urinary thromboxane B2, our observation identifies a potential benefit of aspirin in preventing lethal prostate cancer in this high-risk group of men through inhibition of thromboxane A2 synthesis. Thank you for listening, and my contact details are on this slide for anyone who may have any follow-up questions or comments.